Hi, I'm Dr. Sian Cole, and this is my video on discussing the differences between psychologists, psychiatrists, and psychotherapists. So the aim of this video is to describe the differences between these different jobs. Very common to get them all confused because they all start with psych and sometimes are abbreviated to that, and people don't always discuss the differences. So I hope this video helps. So first off, I'm going to discuss the differences in training amongst these three different professions. So psychiatrists are medical doctors. That's what they've gone and done their university training in, and they've done probably a few rotations in different fields before specializing in psychiatry. So they've done further training to be able to specialize as a psychiatrist, and that is the study and treatment of mental disorders. Whereas psychologists, they have done an undergraduate degree, so at least 4 years, including an honours year. And then they've gone on to do 2 years of postgraduate study, such as a master's or a doctorate, which is 3 years. So the title psychologist is registered in Australia. So psychologists have to go through a number of accredited training programs and registrar programs to be able to have the title psychologist, or the more specialized titles that exist in Australia, such as health psychologist or clinical psychologist or neuropsychologist. So there's a few of those. Because psychologist is a registered title, only people who have fulfilled all that is needed can actually use the title psychologist. And psychologists can work both in academic settings, doing research and teaching, and also in clinical settings. So face-to-face work that could be in private practice or in a hospital or in a forensic setting, so on. Psychotherapist also can be called counsellors, health coaches. There's a variety of different other terms. Social worker as well can be a psychotherapist. So to practice informally as a counsellor, you don't necessarily require a qualification. It's not a registered title. There are counsellors out there that are probably part of the Australian Counselling Association who have registered with that organisation, but they're not part of APRA, which is the Australian Health Practitioners Regulation Agency. So these terms don't necessarily say that people have the same training as others, though typically most counsellors will have gone and done some study. So definitely if you are seeing a psychotherapist or a counsellor, you might just want to determine what their level of training actually is. And there's some excellent counsellors, psychotherapists out there. You don't necessarily have to be a psychologist or a psychiatrist to be able to help people. Focus. So the focuses are different amongst these three different areas as well. So psychiatrists, being medical doctors, are going to be focusing on the biological reasons that people are struggling with mental illness, and they're going to use medications. So these doctors will be looking at biological brain disorders. Psychiatrists tend to work with people with more severe mental illness, such as schizophrenia or bipolar, or severe major depression disorder, because the need to have some medical intervention is needed. Psychologists, as a lot of people are very aware, do not prescribe medication, but what their real focus on is looking at how humans behave. So we're kind of those behavioral experts. We do look at how people think and how they feel, and help them managing those so people can perform the best at whatever their issue is. So psychologists can work with couples to help them perform better at their relationship. Psychologists can work with athletes to help them improve their performance. Even if they're feeling very anxious, as you can imagine, being a high performance athlete, it could be very difficult to perform. And so psychologists are definitely going to be looking at a bit more of the bigger picture that people are presenting with their problems and try and take a more personalized approach. And sometimes we'll be working alongside a psychiatrist to help people manage their mental health. Psychotherapists' focus, rather than imposing a medical or behavioural model, is really about helping people find their own way, help let the clients take direction over the session. And they can do that through reflection, listening, challenging, and really creating a good and trusting environment. So a place where people can kind of build themselves in an empathetic environment. So a lot of people are more looking to find someone to talk to about general life problems. A psychotherapist can help people with those access. So to see a psychiatrist, you need your GP to refer you to one. Now, the costs definitely vary, and there is a Medicare rebate. So the first session normally costs more because they're going to be doing a report and assessment, where follow-up consultations, probably just to manage medication and side effects, are a little bit cheaper, but there is still a gap to pay. So you can see psychiatrists through public medical and mental health systems. However, there does tend to be a long wait list, and because of that, they tend to just prioritise people who are in a serious crisis. To see a psychologist, there's two ways that you can go about it. You can approach a psychologist directly. So you can do your own, Google search and find a psychologist close to you and pay the full fee. However, you can also access psychologists through Medicare, and that will require you to see your GP so they can do a mental health treatment plan. So generally, it's been 10 sessions. However, during COVID, it has increased to 20 sessions. As we're aware, there's been a big mental health strain due to rolling lockdowns and a number of impacts that COVID has had on us. So rebates range from $88 thereabouts to $128, depending if the psychologist is a clinical psychologist or not. And fees can range from bulk billing, though that can be hard to find, especially these days, and maybe up to $280 plus per session. Each psychologist is able to set their own prices. So you might want to speak to them about what they're actually charging, what your gap fee will be after the mental health treatment plan rebate. So hospitals also tend to have access to psychologists for health psychology support. So there's inpatient psychology that can be available for some patients who are struggling with their adjustment to their health and other things. Psychologists tend to work in pain clinics and cancer clinics as well. So just talk to your treating team to see if there is access to a clinical health psychologist for you. In regards to seeing a psychotherapist or counsellor, you don't need to get a referral. You just approach them directly. You can find out through, your friends and family, word of mouth, to find a suitable counsellor, or again, get on the internet and have a look. Fees definitely vary. There is no Medicare rebates for counsellors, But do note that there are accredited mental health social workers who can have access. So you can talk to your GP about that, or do your own research. Anyway, I hope this little video helped you gain some more understanding on the differences between psychologists, psychiatrists, and psychotherapists.